You're listening to the Fibromyalgia Podcast with Tami Stackelhouse, Episode 7. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse. Today, I'm going to be interviewing Dr. James Fricton about coaching, about the science behind it, and about what he has seen as a pain specialist and researcher in his own practice on the benefits of coaching. We're going to be talking about the research, we're going to be talking about the science, and we're going to be talking about the benefits that you can see as a patient in your own life. Now, at the end of this interview, I'm also going to be sharing a little bit of a recap and a little bit more details on one of the studies that Dr. Fricton mentions in his interview. So I hope you'll stick around after the interview to hear some of those more specific details. And don't worry, as always, I will have links to all of these research notes, all of the studies, the classes that he mentions, and everything that is currently publicly available. I will link in today's show notes. So you'll be able to go to fibromyalgiapodcast.com/7. This is episode 7, and that will give you all of the links to everything you need. Now, there will be some things I won't be able to link to because, of course, in this episode, he is talking about a few things that are still in process, a few studies that haven't been published yet, and a few programs that he's working on that aren't available to the general public, that are only available to providers. So everything I can link to, I will. And just know that if something hasn't been linked to, most likely it's not publicly available. So again, it's just fibromyalgiapodcast.com/7 for episode 7, and you will find all of those details. Now, let me introduce today's guest. Dr. James Fricton has over 30 years of experience in clinical care, research, and teaching in the field of chronic pain, temporomandibular disorders, TMJ, and health informatics. He completed his doctoral of dental surgery degree and postgraduate studies in computer science from the University of Iowa. He also completed a master's degree in oral biology at UCLA School of Dentistry and an anesthesiology and pain management residency at UCLA Medical Center. After his research and clinical training at UCLA, he joined the faculty at the University of Minnesota. Dr. Fricton is a senior researcher, pain specialist, and a member of the Health Partners Institute for Education and Research. He is currently the president of the International Myopain Society and has been on the board of the American Pain Society and American Academy of Orofacial Pain. He is an avid researcher, a teacher, author with 5 books and over 150 publications and abstracts. This is a guy who is actually doing the research and doing the work. He maintains an active private practice for patients with TMJ, orofacial head and neck pain in Plymouth and St. Paul, Minnesota. He will actually talk a little bit about the patients that he's seen and the results that he's seen as part of this interview. Welcome, and thanks so much for doing this interview with me. I'm excited to have you share some information about health coaching, what you've seen in your practice, and some of the research that's currently being done. So thank you so much for being here.
It's my pleasure, Tami, and it's great to share some of the experiences that we've had of how important coaching is to pain patients, but I think to the future of healthcare also. So, and thanks for all the wonderful work you're doing.
Thanks so much. So what I would love to start with, and I don't even know the answer to this, so I'm excited to actually hear what you have to say about this, but how did coaching first come into your life? How did you become aware of coaching and become such a fan of coaching? Because every conference I've ever seen you at, anytime I've ever talked to you, I always hear you talking about the benefits of coaching, and I'm curious how that all started.
Well, it goes back to the days of learning to be a pain specialist. And as I realized, as I did more research and had more clinical experience with patients, I realized that it's not necessarily about the treatments that I provided, but it's about that relationship that I have with patients. And when I used a lot of self-management strategies and teaching them and coaching them and training them to make the changes that they need to do to get better, patients would improve dramatically. So from that point of view, I thought coaching was really important until I realized that Karen Lawson, she's the director of the health coaching program at the University of Minnesota, and we were involved in some activities together, and including grant research, and I realized how not only how important coaching is, but how important it is to develop coach training programs to be able to have enough coaches to provide that care for the patients that really need it. And coaching is a very unique profession. You have to be compassionate and understanding and empathetic. And the people that I've met within the coaching field have been just amazing so far. So it's, I'm really sold on health coaching, and I think it's really the answer to the healthcare system to try to make it much more patient-centered, which is the most important transition we need to make.
Absolutely. I totally agree with that. So, were you trained in coaching at all, or did you just sort of look at what it was that you were doing with your patients that made the difference, and you just those were things you naturally did?
Well, I was trained as a pain specialist, but when I was within my residency program in anesthesiology and pain management, I realized that it is these patient-centered factors that were very important. And that was many, many years ago. And at the same time, I was learning acupuncture. And with acupuncture, one of the things that they do when they do acupuncture is they don't just stand there and maybe do another patient. They talk to you and they coach you on the changes that you need to make. And that is something that is in ancient history. And so with that, what I've been doing with my patients ever since that years back in the 70s is to really focus on teaching the patients what they need to do. So it started with acupuncture originally as a pain specialist. However, it's very difficult to incorporate coaching into a pain management practice because you don't get reimbursed for it. So more recently, one of the things that we're doing is really working with the health plans on trying to get reimbursed for preventive medicine counseling, which is really preventing chronic pain, addiction, disability, and ongoing dependency on the healthcare system by a coaching model. And so I've been successful in working with the health plans on really making this sort of transition that needs to happen in the healthcare system. We need to focus on preventing chronic pain and addiction instead of simply treating pain conditions and having relatively short-term relief.
Absolutely. I totally agree with that. And I think that that's actually, you touched on something that's a big frustration for a lot of patients, is that we go to our doctors and we'll hear things like, you need to change your diet, or diet and exercise are the two things we probably hear the most often, but we're also not getting any hardly any help on how to actually make those changes. And especially when you have something like fibromyalgia, it's like, okay, I'm supposed to eat better, but I don't have the energy to go grocery shopping, or I don't have the energy to cook. So how do I actually do this? Right. And that's, I think, the magic of having somebody to come alongside you and help you strategize and figure out the actual implementation of the things that we know we should do.
Yes, that's so important because what we find in our routine clinical practices is, we provide treatments, physical therapy, exercise, medication, prescriptions, whatever. But we don't have a lot of time in our schedule in order to really sit down and explain patients, to do more coaching, not even to teaching them. I mean, I go through a lot of self-care with my patients, but it's really about that coaching process, which is a different process than training people on what to do. It's really reinforcing that self-determination, that engagement and empowerment. And how do you develop that relationship with patients to really make sure that they feel empowered to achieve their own goals that are self-determined? And so some of those characteristics of coaching, positive psychology, self-regulation, self-evaluation, mindfulness are things that are critical to teach, but it takes time to do that. And it takes somebody to really work with on a regular basis to achieve that. And so I have found so many benefits of the health coaching model, not only with me coaching my patients, but also having health coaches work with me in that context also.
Definitely. I know for me, one of the big things was having somebody who first of all, I knew well enough and knew me well enough that I couldn't just gloss over stuff, right? So you had to have a deep enough relationship that they knew the right things to ask and knew when you were like, oh yeah, that was fine, when it really wasn't. Right. And then the other piece was actually having somebody to troubleshoot stuff with. I really wanted to do this thing, but I wasn't able to follow through on it. And so how do I make better choices next time? And be able to actually have that dialogue and that troubleshooting and the brainstorming to help me get to where I wanted to go.
Yeah, there are so many changes that, as you mentioned, that we need to make within pain management. I mean, the big three that we work with patients is really posture, reducing repetitive strain, and exercise, stretching, conditioning, strengthening, and those three things. Sports has already figured this out, how important coaching is. Executive management has figured it out, how important coaching is. We need to apply it to health now. And we need to create what we call a transformative care model. That's a model where you integrate training of patients and coaching with treatments using a team with a health coach and technology. Technology is particularly helpful because it can do a lot of the training, the teaching that needs to be done. But it's really that relationship with a health coach that allows them to really implement those changes that they need to make within their life to reduce the causes of the pain. I mean, it's great to do the treatments, and treatments work fine. But if you reduce the causes, you're going to have this much more long-term effect and outcomes. And some of the studies on health coaching have been very remarkable in supporting them. And I know one thing we wanted to talk a little bit about was some of the research associated with coaching.
Yes, exactly. I would definitely want to get into that because I think a lot of people, if they don't really understand the you use the word transformative, which I think is perfect because we're not just managing something that you have, we're actually trying to change it, to transform it, and transform you and your life and let you be able to live the life that you want to live rather than just treading water somewhere, right? So they don't understand the science, and there's actually science behind this. So I would love to dig into some of those studies. I know you have a couple in particular that you want to share. So why don't you go ahead and do that?
Well, I know the one that we talked about was the study by Hackshaw. It was published in 2016 in the Biomedical Central Journal. And that looked at pain patients, particularly fibromyalgia patients, which are a unique subset of chronic pain patients because of the generalized sort of central sensitization that occurs to make you sensitive everywhere within your body, as well as fatigue and difficulty sleeping, stiffness, many of the characteristics. And they did a model, they had a case series of 9 patients, and that they found that just coaching alone, without a lot of training, just that relationship with the patient to encourage setting goals, achieving the goals in lifestyle changes like diet and sleep and relaxation, stretching and exercise, which are critical to fibromyalgia. And they found that the pain level as well as the functional status both improved by in between 32 to 44% with just a coaching model alone. Yeah. And there's been a couple other studies that have been pretty remarkable also. I know I mentioned, I think we talked about Becky Curtis's study that was published in the Journal of Applied Biobehavioral Research. And that study had a series of 51 patients that they studied with, again, a coaching model. And they found about 50 to 75% reduction in the pain level within that study over a period of, it was about 6 months or so. However, interestingly enough, within the first 2 or 3 weeks, there wasn't a lot of change. So it's really this coaching over time that is really the key element within that study.
Absolutely. And one of the things that I know from the study they did with fibromyalgia is that those numbers that you shared were actually, if I remember correctly, they followed the patients for a year. They worked with a coach for a year, and then they also checked with them a year after they finished coaching. And I think that's actually where some of those numbers are coming from, is 2 years after they started. So a year of coaching and then a year without coaching, which is really quite impressive, because a lot of treatment options that you see, you might get benefit while you're doing it, but to have those same kinds of results a full year after you've finished your treatment, I think is something that we should really be taking notice of.
Well, and that's why we reinforce this whole idea of a transformative care model, because it doesn't just provide treatment to give some short-term or mild effect. And the systematic reviews of pain treatments have demonstrated that they do work pretty much universally. All pain treatments work generally, but it's only about 10 to 20% above placebo. And often those results, like for instance, chiropractic, physiotherapy, some of the medications are short-term results. So when you then also provide that training and within a team of health coaching over time, the results are much, much more effective. And some of the clinical trials and the systematic reviews that are on exercise, like yoga therapy, mindfulness-based stress reduction, meditation, and coaching, have all demonstrated within randomized clinical trials that they work long-term. And that's where we need to really focus our energy within the healthcare system, is really how do we implement these changes as part of routine care.
Mm-hmm. Absolutely. One of the things that I noted about the fibromyalgia study that you didn't mention, that I think our listeners will be particularly interested in, is in that year after they worked with a coach. So in the year after they finished, while they weren't working with a coach, the healthcare utilization, so the number of doctor visits, went down by 86%. They went from seeing the doctor 11 times in a year down to an average of 1.5 times in a year, which means money saved for the patient.
Well, and that's why the health plans have really focused a lot on how do we incorporate health coaching into routine care, because pain patients on the average cost anywhere from $10,000 to $40,000 per year. And we did some estimation of what happens when you integrate health coaching into routine care, that we would estimate that the cost reduction would be at least 50%. And in this study, it was even more than that. And there's a couple other studies that have demonstrated that significant improvement within the healthcare cost and healthcare utilization. I mean, it makes sense. If you teach the patients to reduce their causes and gain them a sense of control over their pain, they're going to rely more on their own empowerment and engagement in those activities that make them feel better. It's just a natural thing to have happen. And it's the coach that really facilitates that change over time.
Exactly. I think most of us as patients, I know I was there when I started off, when I was diagnosed, I would end up in a flare and I would think, what did I do this time? Right? Like I would have no connection between the things that happened to me or the things that I did and what I was feeling at any given moment. And that was a huge piece that my coach helped me with, was being able to make those connections. And now I'm at a place where I know, okay, May is going to be a crazy month for me. It's Awareness Day. I've got like 4 trips during May. And so these are the things that I'm going to have to do to make sure that I don't end up in a flare. And I'll tell you guys right now, I fully expect to go through May with no pain. But there will be a whole lot of stuff that I do that you won't see. But that's all stuff that I learned, right?
Exactly. I mean, that's the whole bottom line, is that once the patients realize that they have what's called self-efficacy, that they have a sense of control over their pain, more than just taking medications, pills, or going and receiving some type of passive therapy or injections, that when they gain that control, it's really empowerment. I mean, it says basically, I really am responsible for myself, and I have the ability to improve my pain. Now, everybody has pain conditions: back pain, neck pain, shoulder pain, fibromyalgia, some more severe, some other. We all need to learn these skills of how the pain is telling us something. It's teaching us something. It's telling us, oh, there's a problem right here. We need to figure out what we are doing that may contribute to it, and how do we best reduce that over time? How do we prevent it from becoming aggravated over time? And you do a great job with that too, within your coaching program.
Thank you. There's a reason my first book was called Take Back Your Life. I mean, as patients, we feel so powerless sometimes, like we're at the mercy of our doctors, we're at the mercy of our insurance company. I have a friend with fibromyalgia who was just denied a shoulder surgery. And that shoulder condition doesn't necessarily have anything to do with her fibromyalgia, but it's a trigger for her pain, right? And so we feel this real sense of powerlessness many, many times. And I think everything we can do to take back that power, to take back control of our lives and of our health, I think puts us in a much better situation, especially with everything that's happening right now with pain medication, right? If
Yes.
that's the main thing that you're relying on, and that gets taken away, for those of you who are listening who haven't followed me on Facebook, Oregon actually was just voting on limiting opioid pain medications to only 90 days period for fibromyalgia patients. I have never met a fibromyalgia patient that could get their pain under control in 90 days. I don't think opioids are necessarily the best way to go. I think there's lots of other options, but I think when we're taking that away for a population, I think that becomes very dangerous. So.
Well, and that's the thing that's very important, is that you have to give the patient a variety of different tools. Self-management is clearly the most important one, but the different treatments, whether it's sometimes chiropractic manipulation, physiotherapy, medications, including opioids in some situations, and I have several patients on long-term opioids because that works. So that's just one more tool for which to put in your toolbox to manage pain conditions, particularly fibromyalgia. Now, it is true that opioids do increase sort of sensitization of pain over time, but there's ways to use opioids in such a way to prevent that from happening.
Exactly.
And this is why we believe strongly in this transformative care model, where you integrate treatments with training. You don't do one or the other, you do them both together. And we've developed a program called the PAC program. It's the Personalized Activated Care and Training Program that integrates both treatment and training together. And it relies on technology to do several things. One is risk assessment, to really identify what are those factors that drive chronic pain that happen to be in your life. Number 2, it does risk reduction training. So once you've identified risk factors for driving chronic pain, then you can train yourself in reducing those specific factors. And it uses the concept of micro-learning. So it's on the computer, but it's 5-minute lessons really on the critical elements that you need to know about that particular risk factor, like diet, or how to get a good night's sleep every night, or how to sit properly if you're sitting all day long. I mean, there are so many different, and we evaluate about 36 different risk factors put them in micro-learning tools. But learning them online is not the answer. That certainly gives you the information, but it's the coaching over time. So within the program, the coach uses telehealth, preventive medicine counseling to work with the patients over the phone. They can do video conferencing like we're doing right now also if they want, but phone seems to be the choice for communication. And the coaches work with them over a period of 6 months or more, with calls maybe once every 2 weeks or so to really connect with the patients, develop that coaching relationship, help them set the goals, purpose in life, how to achieve specific changes in lifestyle factors, relationships, all the things that cause stress and increase pain over time can really be coached in terms of the changes. And so the program has been very successful. We did a randomized clinical trial with that compared to, say, usual self-care. So you did treatment plus usual self-care or treatment plus the PAC program. And those patients in the PAC program not only had higher levels of satisfaction with the care, but they were able to change pretty much every outcome measure we looked at, from self-efficacy to functional interference to pain level. And so it was really an eye-opener in terms of the results.
And I know you have stressed on multiple occasions that the PACT program is a health coaching program with an online training component, not an online training program with a health coaching component. You want to talk about the difference a little bit there? I know you kind of did because of the value of coaching, but.
Yes. Well, that's an important fact to realize. There's a lot of online programs to learn about these specific risk factors for all kinds of chronic conditions. However, they have high engagement, but they do not necessarily help a person change the lifestyles that they have. It takes that engagement, that empowerment, that relationship, that therapeutic effect of a relationship to coach you through the changes that you make. That's really the critical element to make it successful. And it was clear within our study and many of these other studies that we're commenting on that it's that relationship with the coach that really gave them the energy and the insight and the self-efficacy to really make the changes that they need to get better.
Perfect. I know there's one study that, one quote that I wanted to mention. I'm actually going to read that here. This was from actually a study that was done on blood pressure, talking about the difference that working with a coach made literally on a patient's blood pressure. This was Dr. Bodenheimer, who was the key researcher. He said, the more calls between a coach and a patient, the better the patient's blood pressure. It's almost like a medicine. If you increase the dose of coaching, you get a better result. And I love that quote because I really do see coaching as a treatment option, not like just, talking to a friend or something nice to do. Like, we are actually helping you have less pain and live a better life and have more energy and all of those things. And we see this again and again, whether we're talking weight loss studies. There was one study where they compared peers and like mentors to a professional coach, and the professional coach got them like an order of magnitude more results, more weight loss, lost it faster. They also did this with diabetes, looking at A1C numbers and those lowering the more they worked with a coach. So we do see this over and over again in multiple places and lots of different conditions.
Well, and there's another study that's interesting by Illis in the Journal of Physiotherapy that was really interesting and published in 2011. And they did a randomized clinical trial with physical therapy alone for back pain and combined physiotherapy with health coaching. And they found within that model, again, there was not much difference in the first 2, 3, 4 weeks or so. But within 12 weeks, only 3 months, there's a significant difference in functioning within the group that had both physiotherapy and health coaching together. And then long term, they had a much more significant effect, both in functioning as well as a sort of a sense of self-efficacy and expectation that they're going to continue to get better. So combining the two, physiotherapy with health coaching, treatment with training and health coaching, is really the key factors that I think is going to drive the best long-term success.
I totally agree. I know that there have been lots of times when I've worked with clients who, for whatever reason, did not have a good provider on their team. Either they lived in an area where there just weren't a lot of options, or, whatever their reasons were. And it's hard, even as awesome as coaching is, it's hard for me to get them results without also having the other side. Like, we really do need this collaborative team effort in helping patients get better.
Well, and so what we need to do, what we have done with this PAC program, is try to create a system, what we call a patient engagement portal system, that allows the provider, the physician, physical therapist, chiropractor, dentist, whoever is the treating physician, to be able to write that prescription for sort of self-management training and coaching within the context of an office visit. And so to be able to then quick enroll somebody within a program like that, so that the coach is connecting to the patient, the coach calls the patient, begins that relationship, and the patient goes through training at the same time. The system also allows both the provider and the coach and the patient to kind of track their progress over time as they continue to get better. And it has the risk assessment, risk reduction training, and the interaction and connection with the health coaches. So it's a model that we believe could become part of routine care. And the best thing about it is that the health plans have been reimbursing it as part of this preventive medicine services, so that it would be covered 100% without deductible, without copay. And that's one of the best things, because one of the financial limitations is one of the aspects of all of healthcare. And if this can be something that could be incorporated with every health plan, I think it will be a transformative, not just for the patient, but for the whole healthcare system.
Right. That's what I've seen too in working with the doctors that I know, is that, it helps everybody involved. It obviously helps the patient. It helps the doctors, because they're actually seeing patients get better and follow through on the instructions they're given, right? They're not having the same conversation over and over. I need you to do this. I need you to do this. It's actually happening. It helps the healthcare system in general, because it's overburdened and extra expensive. And ultimately, long term, hopefully it's even helping our economy and our government, because we hopefully have more people who are functional, right, who aren't on government assistance, or who can't work. If we catch people earlier, the better results we have in getting them to be able to keep working, right?
It's all about preventing chronic pain, preventing addiction, preventing disability, and preventing that ongoing dependency on the healthcare system. Healthcare is, of course, not just for acute problems, for chronic problems too, but with every one of those chronic problems, they really need somebody to kind of get within their lifestyle, not just to have them drive a half hour to go to the doctor and spend 20 minutes just talking about it, but somebody who's actually going to call them within their lifestyle, interact with them, really to help make those changes that need to be done. And to me, that's the beauty of health coaching, is to really integrate the care into the patient's life.
And I think a lot of times as coaches, there are things that we will see that your doctor isn't aware of, simply because we're interacting with you more frequently. We are getting into your life a little bit deeper. And so there have been several times where I have been able to give the doctor important feedback about patterns that I see, or symptoms that I see, that may not be coming up in visits, which then allows them to treat the patient better, maybe get things that were sliding under the radar or more effective treatment options. So it's definitely all of us working together for sure.
Yes, and the PAC program has the ability to do two things. One is communicate directly to the physician or the provider who's providing the care and the treatment. So there's ways to notes and to send confidential, secure, HIPAA-compliant emails back and forth. Now, in addition to that, it also has the ability to really help the patient identify when there are some really specific red flags or more complex mental health issues, whether it's suicidal ideation, depression, abuse, and addiction, and other things such as that, and to be able to connect with a health psychologist immediately on the same day as required, with discussion and consent with the patient or the client. And so the ability to connect both to the health professionals as well as to health psychologists as you need to really is also very important. And so the coach actually can kind of be the center to some extent of care within the patient's lifestyle. They don't necessarily do care coordination, but they can really facilitate communication back and forth, because one of the difficult things about care, especially with complex chronic conditions like chronic pain, is that communicating with the provider. So it's very true that the coach can play a really significant role in improving the treatment also.
Absolutely. So you brought up mental health, and this wasn't one of the things I mentioned that we would talk about, but I would still love to ask you because I know this is something that a lot of patients aren't really clear on, which is the difference between working with a coach and working with someone like a counselor or a psychologist. Because I've had clients who were working with me and a counselor or psychologist, because it is very different. But I was wondering if you would talk a little bit about that.
Yes, we have both coaches and health psychologists within our clinic, because the coaches really help the patient make the changes that they need to make within their lifestyles, whether it's diet, sleep problems, posture, repetitive strain, etc. Behavioral changes specifically. Whereas a counselor really connects with the patients to get into deeper issues that really have, for instance, past trauma, that really require some more in-depth discussion about. And a coach is not going to do that. I mean, that's really the responsibility of a counselor, health psychologist within that. And both of them can be very helpful, but nonetheless, I think it's important to recognize when a patient needs more sort of mental health support and care for those specific deeper issues.
Absolutely. As a coach, that's not stuff I'm trained to dig into. And it's not just past trauma. It's also if you have severe anxiety, depression, even food issues, like working with a health coach. Maybe you're working with a health coach on losing weight. If you actually have some eating disorder type of things, we're not trained to handle that. So it's quite often people will actually need both for different areas, just like you might need different providers. You might have a neurologist, you might have a rheumatologist, you might have your primary care, and all working together, hopefully. Right?
Well, and that's the key, that's why having a patient engagement portal in addition to an electronic medical record is critical. The electronic medical record provides the very important medical data that you really need to understand that physical condition that the patient has, the medical condition. But what the patient engagement portal does is really allow communication between coaches, health psychologists, physicians, and other health professionals. And in addition to that, it also provides the ability to bring family members. As we all know, family members and friends are critical support systems to really make the change that you need. If everybody in your life is eating poorly, you're going to eat poorly.
Right.
But if you can bring that knowledge and the kind of coaching and energy to the people that you have in your life on a regular basis, it really helps make those transitions, the transformation occur much, much easier.
Absolutely. Totally agree. So what do you see as for the future of chronic pain and fibromyalgia? So when you look, 5, 10 years into the future, what do you see?
Well, that's a good question. Of course, I'm a researcher and a clinician, pain specialist. And so I'm always trying to come up with sort of ideas that really will help patients. That's the bottom line. How do we best help patients over time? And so what I see happening right now, we've developed the PAC program. There are other platforms out there that are evolving. And I believe using technology, and the Institute of Medicine in 2011 recognized the importance of that. They stated that coaching is critically needed within healthcare, but also the use of apps, cell phone apps, patient engagement platforms, website training, and things like that need to be integrated together. So I see in about 5 years or so, especially with the excitement that the health plans have within programs such as the PAC program and the importance of coaching, that I believe that nearly every clinic, particularly pain management clinics, is going to have a coach or multiple coaches that are involved in managing their patients over time. So I think that is probably one of the critical shifts that occur. Now, and what that does means basically is that the healthcare system is going to continue to move towards what we call patient-centered care versus treatment or provider-centered care. Patient-centered care is all about the patient. How do we create a system of healthcare providers and care that really transforms that patient and really provides the care that they need to actually get better long-term? And so patient-centered care really is where it's at. And I think that within 5 years, and every provider I talk to agrees with me to some extent that patient-centered care is really the goal. And that's to achieve what's called the triple aim. Are you familiar with the triple aim?
I don't think I've heard that.
Well, that's the Institutes for Healthcare Improvement's goal for the healthcare system. So the first aim is to really engage the patient. So makes it. Second aim is to really improve those long-term outcomes. Mm-hmm. And the third aim is really to reduce long-term healthcare costs.
Yep, I just about could have guessed those.
Yes, right, exactly.
I'm glad they've identified that, because those are the problems that I see. Those are the problems that I think most people see. So that's awesome. They've chosen the same things we would. So yeah, A+.
Yes, exactly.
Perfect. So what research are you particularly excited about at the moment? I know you've got some things that you're working on, but whether it's yours or somebody else's, what things are you excited about?
Well, we're doing several things, and the focus is really on preventing chronic pain, addiction, disability, et cetera, and ongoing dependency on the healthcare system. So we have a campaign that we're doing right now on preventing chronic pain. We've worked with several national and international organizations, including the International Myopain Society and the International Association for the Study of Pain, and we're working with some other groups too to engage them within a movement in 2020 to make the year of 2020 the year of preventing chronic pain. Now, with that, there's several initiatives, both research as well as training initiatives for providers that really help in making this a significant success. One of them is, of course, courses that are online. One is on Coursera that we offer. A group of mine pain specialists put together a course on preventing chronic pain, a human systems approach. That's on Coursera.org. That's available.
I will actually, just to jump in there really quick, I will have that for those of you who are listening to this, that will be in the show notes. So just go to fibromyalgiapodcast.com and I'll have links to all of these studies, but also specifically this Coursera course. I took it back in 2015, and in spite of, being a coach for 6 years at that point, I still learned a lot. There was a lot of really good information in there. So for those of you who are interested in really learning new ways to manage your pain, or just interested in the science behind pain, there's a lot of that too. So highly recommend that. And it'll be in the show notes. Okay, continue.
That's good. And in addition to that training program, we also have training for health professionals. Although that was designed for health professionals, also half of the people taking it were patients, and 93% said that it changed their life. So we were really impressed with that. Providing good scientific sound information about pain, what causes pain conditions and how do you prevent it, is very useful information. So we have 2 more courses that are skills courses for health professionals to really learn about transformative care. One is through the Institute for Healthcare Excellence, and they provide a 1-day skills course on patient communication and implementing transformative care for pain conditions for any health professional. So it's a very good skills course. It's a small group, 20 to 25 health professionals getting together to really discuss how do you do this on a routine basis. And most importantly is how do you get reimbursed for it. And then we also have a course through the International Myopain Society. It's a 1-day skills course on pain management skills. So this is for any health professional, from physicians to chiropractors to physiotherapists to dentists and others, to learn the basic skills behind pain management. So in addition to coaching and sort of the whole training programs, what should the health professional do to examine the patient, identify joint limited range of motion, neck limited range of motion, back limited range of motion, tenderness, trigger points, fibromyalgia? How do you diagnose those basically? We have some experts who have been in the pain management field for years through the International Myopain Society who will be teaching that. We're also developing a curriculum course that is online for health professional schools to integrate within their curriculum on transformative care for pain management. So that's a little bit more longer term, but we're hoping to have it done by 2020. So if health professional schools, medical schools, dental schools, chiropractic schools, et cetera, want to incorporate this into their curriculum, it can be done.
That's fantastic, because there's not that much that's really being taught, I don't believe, on these more long-term chronic pain conditions and managing chronic pain as opposed to just managing acute pain. So I think that that's really critical for equipping our providers to be. So
yes. Well, and also we are doing a few other things too. Like for instance, we're developing some consumer-based information about transformative care. So what happens when you have a pain condition? And so it's kind of like a reality TV show, but it's about
a day in the life
called,
of a pain patient kind of thing.
Exactly. And there's a lot of other programs, like, for instance, the National Fibromyalgia and Chronic Pain Association will have regional sort of support groups for patients. And I know you're involved in that to some extent also, which is very helpful for patients. And blogs, you're involved in that. So some of the work you're doing, Becky Curtis is doing, and there's about, quite a few health coaching programs around the country that I think are going to be very helpful in terms of providing enough support for patients, but also support for health professionals to integrate health coaching into their routine care. That's such a critical aspect to do.
Yeah. And that's the challenge I think a lot of providers are having right now, is that if they are aware of the benefits of coaching, they're a little bit at a loss for how to get their patients involved with that, right? Rather than just telling them over and over, you need to work with a coach. You need to work with a coach.
Yeah.
So I think all of these things are great. Is there anything that you think we should be spending research money on that isn't being done yet?
Well, next week, actually, I speak to the National Academy of Sciences on temporomandibular disorders. And I think that we do need to understand a little bit more about the underlying pathophysiology of pain clinics and how our pain conditions and really how lifestyle factors play a significant role. How does diet play a role? Like, for instance, we're realizing that that sugar by itself increases blood glucose level and then causes it to crash, and that fluctuation increases inflammation. So some of the mechanisms associated with lifestyle factors I think are really important to really study. And of course, I think randomized clinical trials that are pragmatic trials, which means that they are part of normal clinical care and we're evaluating the outcomes associated with that, I think was very important. And we have a couple studies that are in process, one with United Healthcare and Optum, and another one that's going to go forward, hopefully from the National Institutes of Health, to do a multi-site randomized pragmatic clinical trial to really see, okay, when you incorporate this into routine care, what kind of impact does it really have over time? And we just need so much more research on the health coaching model. Even though there's randomized clinical trials and there's a lot of case series out there, we need some more large-scale studies to show that the big impact that it can have, not just only on functional status and pain, but on healthcare utilization, as you mentioned earlier.
Yes, absolutely. I totally agree. Like I can speak from my decade plus of coaching patients what kind of outcomes the patients can see, but I have not seen as much, just because it's not who I'm interacting with, the impact that it's having on practices, or impact it's having on insurance companies, or all of these other things. And I think we need to see the whole picture here, for sure.
Right. Yes. I mean, when you think about it, if pain patients cost $10 to $30, $40,000 per year, and at least 20, more like 40, up to 40% of the population has pain conditions, that right there is the big elephant in the room of healthcare costs. And by empowering and engaging patients, educating on the changes and supporting them with health coaches, it will have an amazing effect on the whole entire healthcare system. So you've started a tidal wave of change that's going to hopefully spread throughout the country. So
That's
thank you so
perfect.
much for all your efforts.
Thank you so much. My big dream is that we would change what happens when somebody is diagnosed with fibromyalgia. Right now, most fibromyalgia patients, when they're diagnosed, they're essentially told, well, there's no cure. We don't really have much that even works. So, here's a couple of things and good luck to you. And life won't ever be the same again. And, kind of sucks to be you. Like nobody says it like that, but that's kind of what we're told. And my big dream is that instead of all of that, it would be, okay, you have fibromyalgia, but it's not a big deal. Here's what we do.
Right. Yeah.
So hopefully I will accept all of your 5 and 10-year predictions, and let's make that change.
All right. Well, I agree with you. Let's move forward. And we just need more training programs, more coaches to really supply the need that is going to be growing dramatically.
Absolutely. Totally agree. Any last minute thoughts or anything you would like to share with the folks who are listening?
Well, the most important thing is to realize that pain conditions, whether it's fibromyalgia or regional pain like back pain or neck pain or headaches, are very manageable. I had a patient just the other day that she's 34 years old. She had 9 years of pain back here down to her neck and shoulders, sharp shooting pains right back there. She went to all kinds of doctors, had a variety of different medications for it, physical therapy, chiropractic, nothing went away. And within some simple training process of posture and stretching, as well as some treatments, I did a couple of treatments, injections within that. The last time she came, I saw her one time, just once. I saw her a month later. Within 2 weeks of that first visit, she had no pain and had no pain since then. And she says, I don't really need you anymore, Dr. Fricton. So I said, fantastic. I'm happy to follow up sometime in the future, but right now you are on your own. You can self-manage this problem. And she was so delighted. I had another gentleman, just to finish, who was 81 years old. And I was seeing his daughter, and I think I maybe mentioned this to you before this case, a daughter and his wife for pain problems. And they were getting better and everything, and he was sitting in the corner. He came up to me after one visit and said, maybe you could help me. I've had a headache every day for the last 65 years of my life, since he was age 16. He's 81. And within a couple of months, teaching him some basic principles of what he needs to do for that condition, stretching, posture, reducing some strain, forward head posture, some dietary changes, his headaches went down to once every 2 weeks. And it was surprising because he was so angry. And I said, why are you so angry? And he said, well, why didn't someone tell me this, 10 years ago, 20 years ago, or 50 years
ago.
Exactly. So with those stories, I have stories, that type of story over and over again with patients. The most important thing to realize that most pain conditions are very manageable by yourself. So
for sure. And that's the whole focus of this podcast, folks. So if you don't believe that basic premise, then you probably need to find a different podcast, because that's what you're going to hear over and over from me, is that you can feel better than you do right now. We're not necessarily promising zero pain, but you can feel better. You can. So
exactly.
Thank you again so much, Dr. Fricton, for being here and doing this interview and sharing your experience with us. And I look forward to hearing more from you. You're doing some exciting stuff.
Well, you are too, Tami. Thank you for the interview, the opportunity to share this information with others.
Awesome.
I hope you can see why I invited Dr. Fricton to join us here today. He is obviously a huge fan of coaching because of what he's seen it do in his patients' lives and in his practice. So much so that he is actually changing his practice, working to change the healthcare system and insurance companies to have coaching be more of an integrated part of our healthcare system. He wants to create that transformative care model that he talked about, which I love because it's all about transforming your life. Now, there is one specific study that he mentioned. Of course, it's the study on fibromyalgia and coaching. And I want to talk a little bit more in depth about that. He mentioned a couple of statistics, but I want you to hear the whole picture about that particular study. So this was done at Ohio State University back in 2016. And again, just as a quick reminder, all of these details are going to be available in today's show notes. Just go to fibromyalgiapodcast.com/7 for episode 7, and you'll see a link to this study and all of the details I'm about to give you. So don't worry. So again, 2016, fall of 2016, Ohio State University published this study. They had followed 9 patients through 1 year of working with a coach, and then 1 year after they stopped working with a coach. So they actually followed them for 2 full years. Now, the numbers you're about to hear are from the end of that second year. So this is 1 year after they stopped working with their coach. This is what they found a year later. They discovered that patients were still seeing a 31% decrease in the severity of their pain. That means how bad their pain went from, a 6 down to a 4 or something like that. So a significant decrease in their the severity of their pain. They also saw a 44% reduction in interference. And what this means is that the impact their pain was having on their lives, the amount that their pain interfered with these patients' lives was cut almost in half. That's huge. The other thing about this study that I mentioned during the interview is that healthcare utilization was reduced by 86% overall. It was 70-something% for rheumatology visits. I don't remember specifically, but it was 86% in general. All of their doctor visits, their provider visits were cut 86%. So they went from 11 provider visits in 1 year down to an average of 1.5 visits. So we get a half a visit because we're dividing by 9 people, right? The researchers doing this study estimated that the cost savings for the patient was somewhere around $900. Now, of course, this varies a lot depending on, your insurance coverage, how much your doctor charges, whether you've met your deductible or you have a copay out of pocket, if you're seeing specialists. There's a lot of factors there. They just did this on an average of 9.5 visits at about $90 a visit is right around $900 savings. Another cool thing about this study is that they used the revised fibromyalgia impact questionnaire. And they used this to measure their results in addition to looking at pain scores and the interference levels. This is important because this is the measuring stick that a lot of studies use to measure the impact fibromyalgia is having on their patients' lives. This is the measuring stick they use for the FDA-approved medications, for instance. So to give you an idea of how big this is, they found that the FIQ score went up by 35%, meaning people felt better by 35%. To put that in perspective, Lyrica only increased the score by 17%, Cymbalta by 20%, and Savella by 32%. Now, I know many of you have tried these medications and found that they actually didn't work for you at all. And that's part of the problem with these is that, yes, the people it helped an average of 17, 20, or 32%, but there were also a lot of people that they didn't help at all. Probably about half of the patients who try these medications find that it doesn't do anything for them. Another thing that I want to compare this to is a very common counseling and behavioral therapy, which is ACT, A-C-T. It's acceptance and commitment therapy. So it's all about accepting your illness and committing to changes. This only showed a 27% increase. So what this means is that coaching in this pilot study was proven to improve fibromyalgia symptoms more than any of the FDA-approved medications and more than typical counseling and behavioral therapy. And coaching is probably one of the 8 treatment options that your doctor hasn't talked to you about. So we want to make sure you know. The other thing I want to mention is that the PACT program that Dr. Fricton talked about in this episode is not covered by insurance yet. It is something he is still working on. He told me after we ended the interview that he's still in meetings with them, still contracts that have yet to be signed. We're close, but we're not quite there yet. It's also not going to be covered by all insurance companies from the get-go. He has a couple of companies that he's very specifically working with and will expand from there. But just because this awesome program is available doesn't mean it's going to be available to you on your insurance. And I want you to know that, not that there's anything wrong with the program. It's a great program. In fact, many of my coaches are going to be coaches as part of this program. But I do want you to know, because I don't want you to wait. I don't want you to have your symptoms get worse while you're waiting for this to be covered under your insurance. There are lots and lots of coaches out there right now ready to help you today, my coaches, other coaches, and if you're willing to allocate some funds to paying for this out of pocket, you can actually get the benefits of coaching now without waiting. And just keep in mind that one of the benefits of coaching is that it will reduce your other healthcare costs. In other words, coaching does pay for itself. And again, we'll have links to these things in today's show notes. So fibromyalgiapodcast.com/7 for episode 7. Now, in our next episode, episode 8, I'm going to be discussing the unique type of coaching that I provide and teach to my coaches. I'm also going to tell you some tips. So if you're out there looking for a coach, you'll know how to find a good one and what to look for in terms of their experience and expertise, and also what to look for in terms of their programs and whether or not they can meet your specific needs and goals. In the meantime, if you already know you want to explore coaching as a way to reduce your pain and your symptoms so that you can get back to living the life you want to live, you can just go to fibromyalgiapodcast.com. We have a link there where you can schedule a complimentary consultation and we can discuss your options. And of course, if you have any questions or something you'd like me to talk about in future episodes, you can also let me know through that website as well. So I will see you back here next time where we talk about fibromyalgia coaching specifically, and I will see you then. Bye.